Welcome, everyone. My name is Alexandra Major, and I am the Diversity and Inclusion Career Outreach Specialist here at Ochsner Health. We're here today to share with you about the Catalyst Internship Program for this upcoming summer. I am joined by an impressive group of panelists who are going to share more about the opportunity and what it means for you. Panelists, before we get started, if you could please introduce yourself. We will start with Faye, then Renee, Angela, Mohamed, Ariane, and Jenny.
Thank you, Alex. My name is Faye Campo. I am the manager over Ochsner's Summer Catalyst Internship Program. I'm going to throw it to Renee.
Good afternoon, everybody. My name is Renee Gurdian. I'm the Director of Strategic Sourcing. I oversee our contracts and sourcing team, as well as handle our large vendor relationships and partnership with our Vice President of Supply Chain Operations. Thanks, everybody.
Is it my turn? I'm Angela Boudreau. I'm the IS manager. I'm a regional manager. I have the River region, Upper Jefferson, and some of the South Shore that we support. And we mostly do break fix for FTS, and that's what we do.
Now, Mohamed.
Hi, everyone. I'm Mohamed Judah. I'm a former Summer Catalyst intern, and I currently work in patient access.
Hello, everyone. I'm Ariane Bill. I'm a former intern as well, and I'm currently a services coordinator for digital medicine.
Hi, everyone. My name is Jenny. I'm an instructional designer, and I'm also the point person for the IS side of the internship program. Thank you all for joining. We're happy to have you all.
Thank you, panelists. And to the audience, if you have any questions, please enter them in the Q&A box and we will try to get to all of your questions. To get things rolling here, my first question is for you, Faye. What exactly is the Catalyst Internship Program at Ochsner?
Absolutely. Thanks, Alex. So the program was created, we're going on our fourth year now, to help provide students pursuing their undergrad and grad degrees with direct mentorship and hands-on experience to basically assist them in increasing their knowledge of the healthcare industry and positions that are available throughout the organization here at Ochsner. It also helps interns identify important skills needed to be successful throughout their career.
And what would you say are some of the benefits to students who participate in this program?
Yeah, absolutely. So healthcare is one of the largest industries providing opportunities for students studying in any major. Actually, it's the largest not-for-profit employer in the state, offering numerous opportunities and advancement for young professionals. The program offers one-on-one mentorship with the best and brightest leaders, peer networking, online classroom skills training, multiple regions that are available as well too. We're trying to bring opportunities to students in their community and in their regions, experience in relevant issues affecting our communities, and Ochsner's on the forefront of innovation. So it allows students to really bring their talents and their gifts to an organization that continues to strive for excellence here as well. It is a paid position. It's 8 to 9 weeks long. 32 hours per week is what's assigned for each intern that's chosen for the position. And we're a value-centered organization. We're patients first, compassion, teamwork, integrity, and excellence. Those are our values, our core values that we really do live by here at the organization. And it allows the students to identify different career opportunities within the healthcare areas.
And Faye, can you share more about what teams are taking interns and what their experience might look like on those teams?
Yes. So just as you see here, Renee Gurdian will talk a little bit about supply chain. So they take some fellows there. We also have finance and accounting. We have urgent care facilities that look to interns to come in and really, as I mentioned earlier, bring their talents and their gifts to identify opportunities within those facilities and work on some great projects there. We also have, like retail, hospitality, human resources. So the areas in which that students really don't think of when you think of a healthcare organization. We even have security. So we've had students that have come in that have a criminal background interest, and we have aligned them with our security as well. We have with HR, our HR division, it is so large. So in that division, we have talent acquisition, which is like recruitment, which is obviously what Alex and Caitlin do here and are helping us today with this talent talk. We also have our diversity and inclusion, and then our PMO, which is our lean project incentive as well too. So there's a mass opportunity here for our summer internship for students to get placed. And we try to align them with their interests as well too. So as they're applying, we're looking to align their skills and their interests with these departments that are partnering with us.
Amazing. Thank you, Faye. Renee, as a current leader in the organization and mentor for the Catalyst program, how do you see the program assisting young professionals with their career? What skills or qualities were you looking for in a potential candidate?
That's a great question. I think last year we saw some really interesting candidates come through. As Faye alluded to, we have a fellowship program and an internship program. Currently, we have 4 fellows that sit in supply chain. And so when we had 3 interns come through this Catalyst internship program, they were immediately really catapulted into our operations and received some great projects to review from a logistics standpoint, clinical supply chain, as well as our sourcing and procurement team. Really, the benefits of the overall program is actually getting to see and interact with leaders across the organization and specific to that department, as well as trends that you've seen in the past 2 years with remote workforce. It's very interesting and pretty insightful to see how leaders can continue to keep, drive engagement across their departments with team members that are no longer, permanently based. And so the remote workforce is actually something that, a lot of our new leaders, a lot of individuals coming out of graduate programs, as well as undergraduate programs, it's a new day when it comes to this type of new workforce. And so being able to kind of take time, be able to pick the brains of these really dynamic leaders that you get to work with, it's a definitely interesting perspective that you're able to see, as well as hands-on projects. I do think that at Ochsner, we pride ourselves on putting individuals in projects that they're going to be successful at, but they're also going to be, there's some learnings, obviously we kind of have the mantra around here called fail fast. And so you're not obviously going to know everything coming in as an intern. You're obviously not going to know everything coming in as a fellow, even at times as coming in as a frontline team member. But here at Ochsner, we have team members across the organization that really live our values day in and day out through compassion, through teamwork, through excellence. And it's the overall integrity of each of our leaders that drives the success of this program. So getting to interact with at least just your mentors, as well as other department leaders, gives you insight to how much of an organism this healthcare ecosystem really is, as well as we provide opportunities with other departments. There was a gentleman by the name of Sean Wynn, who's one of our managers within the pain management arena, that we actually swapped fellows for a week, that we did a shadowing opportunity. And so that's how great the teamwork and collaboration is across our departments, that we want to make sure that this internship program is as interactive and collaborative as it can be. As far as skills pertinent to the success of the program, really what we look for are self-starters, and curiosity is really what drives the overall success of the program. Interns that want to hit the ground running with any projects that are provided to them, and always understanding what type of curiosity leads them to other type of departments within a division, as well as just being, coming with a humble approach. Leading with humility is critical across the organization. You see that from our senior vice presidents all the way down to our frontline team members. So having that level of humility, being a team player, being collaborative with the other interns that they're going to be paired off with, is really what's critical and what makes a successful intern in our organization and in this Catalyst program.
Thank you so much, Renee. Now let's turn to a past Catalyst intern, Mohamed. Can you tell us about your Catalyst internship experience and what you were able to learn throughout your time in the internship?
Yeah, sure, of course. So for me, I didn't really have any healthcare experience prior to actually participating in the program. It kind of exposed me to a lot of new things. I would say right off the bat, the networking opportunities kind of began just from attending huddle every morning. I was able to meet managers and directors across different departments And, I was really paying close attention to who I was meeting, being that I had, an understanding that I would be working on projects. And if I'm able to kind of understand what departments I can find people in, I know who I can go to and where I can get certain resources that I need in order to complete my projects efficiently. And vice versa, if they understood what projects I was working on and they wanted their clinics to be a part of them, they could kind of reach out to me as well. As far as the projects that I worked on, the first one was a supply chain analysis that was centered around the newly constructed temperature screening stations that we had at Baptist. There were 6 of them total, and they were kind of scattered around the hospital. They were sort of just thrown together, being that COVID kind of got us all by surprise. So in that, I felt like order needed to be established there. I kind of took the time to monitor patient flow at each one and create a par level, not only for the temperature stations, but for the hub that restocks all of them. So you kind of had exactly enough of what you needed. Employees weren't just running back and forth from the hub, and no items were going to waste or anything. And I was really interested in operations. So for me, this was really great to kind of see how different departments operate and how they come together as one to kind of create a hospital. As for the second project I worked on, I was interested in doing something that was directly related to Epic, being that I had taken an informatics course and Epic was brought up a lot. I knew how important it was to the Ochsner system. And when I mentioned this to my mentor, he had a list of about 10 to 12 Epic related projects that I could have chosen from. And there was one that really stood out to me where, I was able to kind of get with the Epic build team and sort of digitize these forms and questionnaires that patients normally fill out in a waiting room. They can kind of just be, sent to the patient via MyChart, and they can just complete them via a smartphone in the comfort of their own home. They don't necessarily have to be in the waiting room. And I thought that was good for really 2 reasons. One, we were reducing the spread of COVID-19, which was, it was essential at this moment in time. This was June and July of 2020, and things were really ramping up. And not only that, but we were able to reduce the workload for medical assistants, kind of giving them more time to spend in the room actually with the patient. So it was a lot of fun. I think it was for a good cause, and it was great to be a part of. As for the overall mentorship, Renee, you mentioned Sean Wynn. He was actually my mentor, the service line manager for pain. And, in the beginning, I caught Sean during his most busy week ever. We were running from the West Bank to Kenner to, Baptist, and we were spending pretty much every minute together. But towards the middle and end of it, we were able to kind of separate a bit. We would still, meet up at least once a week to discuss where I was in my project process. And, if I had any constructive criticism that Sean felt like I needed, I was very open to it, and just advice altogether. We made sure to at least meet up once a week to discuss those things. But for the most part, I think it was great for me. In the beginning, I was actually really quiet. I was kind of observing everyone and analyzing how Sean, as well as the other managers, kind of carry themselves. And then towards the end, I was kind of able to apply those things, and I was comfortable presenting a project report out to our COO here at Baptist and Will Chin, as well as the other managers in the room. So it just goes to show what you can accomplish in this role if you're able to maximize productivity. And I hope that kind of just summarizes what my, experience as an intern was like.
Thank you so much, Mohamed. Jenny, can you share with us additional information about IS here at Ochsner, including the different departments available for potential interns?
Absolutely. So I'm going to complement what Faye said. Faye has her administrative internships that she talked about with HR, and we have the IS side. So we have many different internship opportunities, including opportunities on our Epic build teams. These are the teams responsible for building and customizing our electronic medical record system, Epic. We also have internship positions in field services. This is the team responsible for maintaining, analyzing, troubleshooting, repairing our computer system. They're the boots on the ground. We have opportunities with the service desk, the team that receives calls, chats, and self-service tickets. The Network Operations Center also has internship spots, and that's the monitoring hub and level 2 support for our entire Ochsner organization. Assets also has internship opportunities. This team manages asset life cycles, The computer store, our data analytics team helps Ochsner stay on the forefront of quality and efficiency through proactively identifying opportunities in the use of the organization's data and build improvements. And we have a telecommunications team that maintains telecom-focused infrastructure. We also have internship opportunities on our IS training team. That training team is responsible for providing epic technical and workflow training and support to end users in a virtual classroom. We're continuing to add new departments, seems like every day. So we hope to offer a lot more than what I just listed, but those are some examples.
Thank you, Jenny. And what skills are you looking for in an IS intern?
Yeah, as Renee mentioned, we're all looking for self-starters, but we're also looking for individuals aligned with our Ochsner values: compassion, patience first, excellence, integrity, and teamwork. In general, we're looking for students who are ready to be a part of a team. Our IS team works closely with one another, so effective written and verbal communication skills are a must. In general, we're looking for applicants who have basic computer skills and are proficient in Windows-style applications. Students with strong analytical skills and time management skills are also sought after. So we have different teams, and they might also be looking for something specific. So for example, the training team will look for students who can present information in a clear and professional way to our clinicians. And the service desk will focus on customer service skills and working in a fast-paced environment. So that would be helpful for that team. And for the data analytics team, for example, might look for someone with Excel experience. So it varies, but those are the general qualifications that we're looking for.
Perfect. Thank you, Jenny. Angela, my next question is for you. As a mentor for the Catalyst IS internship, how do you see the program assisting young professionals with their career? What skills or qualities were you looking for in a potential IS candidate?
So I think the program definitely assists the interns in finding careers in Ochsner. I know my intern this summer, when she came in, she knew that she wanted a career with Ochsner. So even though like my team doesn't really do big projects that, are presented like some of the other teams, we are like customer facing. So we take care of everybody's equipment, no matter where you are in the organization. We touch your equipment at some point during the day. So it gives them the experience to not only like work on our equipment, but see how other departments work. I mean, we go to the lab, we go to the corporate offices, some of our field techs go help Warner Thomas. So we're everywhere. So we talk and touch everybody's equipment. We see how their departments kind of work in a big picture kind of way. So it definitely kind of helps them see how all units work together, how Ochsner, what different departments do that they may not know coming into healthcare, because we're quite different than a lot of other, industries. A lot of times in IS, I get people come in to work for me that they've worked on computers like in law firms or whatever. But when you come into healthcare, it's just a completely different animal. And they kind of see that in a field tech service position. What we look for, kind of like everybody else said, we want self-starters. We want somebody that can kind of go out there. And my biggest thing is I want you to be customer friendly, because that is our biggest thing, is customer service. Because like I said, we are nursing units. We're in exec team offices, we're everywhere. So you have to be able to flex your conversation to whether you're working with physicians, CEOs, or, anybody else out there, technicians, whoever. So customer service is our big thing. So when I went in looking for the intern, it was just like I was looking for somebody that I would hire. So that's really kind of what we do.
Thank you, Angela. Ariane, my next question is for you. Can you tell us about your experience as an intern?
My overall experience this summer, it provided the hands-on experience that was necessary to jumpstart my career. You take the time in school learning the academics, but to take that knowledge and apply it to everyday work experience is so beneficial to your success in your future. The experience during my internship, it allowed me to broaden my skill set. formulate lasting connections, and work in relationships. Angela was actually my mentor this summer. Like she mentioned, we didn't have major projects, but we touched just about everybody. Being a field technician, you're like the backbone. No one really gets to see you. They think of the clinicians, but we have to make sure the computers are working, the printers are working, the medical equipment is working. One time, one of the field techs had to go off site. I was the only one there, fresh, brand new. They had a medical device that got offline and they needed to perform surgery. And I was nervous, but I went in there and I fixed it. And it was so gratifying and self-fulfilling for me to be able to put our patients first, to fix that equipment so they can perform the surgery for that patient. I gained so much confidence. From the first day I was able to walk into the door. It wasn't just to sit back and watch, but I was able to be hands-on and to get that experience. I had an amazing team who was so knowledgeable and helpful and so experienced. They taught me so much. We analyzed, we troubleshooted, we compared computer systems and hardware, user account. We did remote, because we have some remote agents, remote technical support, on-site technical support. I established lasting connections and networking that were pivotal for my professional growth, in addition to the hands-on experience and the knowledge of hardware and software that I learned. The mentorship throughout that time, Angela, she was amazing. From the very first day we connected, not only on a professional relationship, but a personal one as well. She took the time to get to know her team. She listened when it was necessary. She allowed us to be self-sufficient self-starters. We were all hardworking individuals. She embodied what a mentor should be. She was a good listener. She was flexible, valued diversity of all our perspectives. She was so knowledgeable, able to help me get the connections and find the resources that I needed. Although that I was a field tech, like Angela mentioned, we went from corporate offices to the lab, to the hospital. So I was able to find my place and get my permanent position and do different things within the network. So IS is so broad. And that's the one thing you will need to do is make those connections, network with everyone, and kind of see where your best foot is. You can start one place and end up somewhere else.
Thank you so much for sharing.
Thank you.
Faye, now let's tell everyone how they can apply for the internship program here at Ochsner.
Yeah, absolutely. So as Jenny mentioned, so there is the Catalyst administrative section, and there's also the IS internship section. So both positions will be posted in January on Ochsner's career page. It'll say Catalyst Administrative and Catalyst IS. So we're asking candidates to apply through that. On that job posting, there'll also be a survey attached to that, which will provide specific information about each area within that internship concentration. It'll ask students to identify their strengths, skills, strengths, as well as what they're looking to grow within the internship. So all of that will be posted in the job posting. So we ask everybody to make sure that they complete that. So we are aligning them with the department that will actually bring the most gratitude to them in development. The deadline to apply, so it'll run through from January to March 11th. And then the actual program will run May 2022 through July of 2022. And as I mentioned earlier, it's a 8 to 9 week program. We will be hiring a good number. Again, I'm sure that will fill up fast, but in IS, there will be some skills that will be required, as Jenny had alluded to earlier. And then for the administrative internship, Renee had mentioned, being humble, making sure that you are self-sufficient and self-guided, and just really here to take advantage for both opportunities, just really here to take advantage and learn as much as they can throughout that 8 to 9 weeks that they're here.
Thank you, Faye. And thank you to all of the panelists. Now, I will check to see if we have any questions that came through. Attendees, please be reminded that if you have any questions, please put them in the Q&A box. I'll give a few minutes for you to insert your questions there.
So Alex, it looks like we have one in reference to communication programs available. Jenny, is that an IS question?
I don't believe so. We don't have any communications in IS.
Okay, I was checking. So I'm gonna go up this line of discussion in reference to communication. So we have a marketing department, which is communications, and we have had mentors that have taken interns in that department. So yes, that is available for an opportunity for an internship as well. And
Thank you,
actually,
Faye.
yeah, no worries. I'll elaborate a little bit on that as well too. Ochsner is so large with so many opportunities. So as you know, asking about communication, if we have a candidate that fits into that area, we're going to have that mentor available to us to be a part of the internship. That's another great thing about Ochsner, is that if we identify talent and we see that their skill set is in alignment to a department that we have available to us, our mentors and leaders are always willing to be a part of it.
Thank you, Faye. We have one question that came in. What types of projects could someone who is interested in HR expect to be a part of?
That's a great question. So as I had mentioned earlier, so we have several different things in HR within Ochsner. So depending on what specific department in HR we're looking for, some of the projects were, so we had somebody in our diversity and inclusion department that worked on a project in collaboration with looking at the culture of Ochsner and being pulled into our resource groups that we have here at Ochsner, and identifying the membership, the criteria for the meetings, looking at how to promote for new employees that are coming in, how to promote our resource groups as well. So it really depends on the need of the organization at the time that the internship is going on. But there's always projects and tasks that are needed to be identified, and different skills that are needed to really help us get to the next level for a lot of these projects and tasks.
Thank you, Faye. Renee, I'm gonna shoot this next question off to you. Why should students consider the Catalyst internship at Ochsner over other opportunities? What is so special about working at Ochsner right now?
Yeah, that's a great question. So prior to my time at Ochsner, I've been at Ochsner for 4 years now. I worked at an organization, Chevron. I'm New Orleans local, born and raised, and my next opportunity at Chevron was going to actually be in Houston and in California. And really what I found out about Ochsner, and it's no discredit to other organizations, is that the real purpose here every day is about our patients. And so what I share, and really what our system leadership and our executive leadership share, is no matter if you're 4, 5, 6, 7 degrees separated from a patient, you're impacting patients. No matter what you do, no matter what service you provide, right? I mean, a decision that we make about a glove is going to impact how a clinician is going to interact and feel a patient, right? So if we're putting a glove into a clinician's hands that's a little too thick, they can't feel their patients, right? A phlebotomist can't be able to feel the veins in order to provide that special and quality care that Ochsner really prides itself on. And so really, I think that's really the differentiator about Ochsner and an organization, and healthcare particularly, is that every day our purpose, no matter what division, no matter what department, is that we are here to provide a quality care environment and experience for our patients and for their family members. Because no matter who you are, no matter where you are a patient to someone. And so I have, my wife, my family members, my father, my grandmother is going to interact one day with Ochsner. And each person that you get to communicate with, interact with, plays a role in their overall experience. And so I really think it's something really humbling that is not lost on any individuals, no matter the division, no matter the department. If you're a clinician, if you're a frontline team member, if you're in a corporate service area, every day we approach our jobs and our duties to know that we are providing the best care, the best quality, and the best experience to all of our patients, no matter their location. With Ochsner's continued growth across the Gulf Coast region, we really feel that Ochsner, the reason that we want to continue to grow is because we believe and strongly believe that every patient deserves quality healthcare in their community. And that's why we stretch all the way to Shreveport. That's why we're in the Bayou. That's why you see us growing in a Gulfport in the Meridian, Mississippi areas, because really we feel like we do a great job at connecting the family with a healthcare that leads by compassion, leads by integrity, and make sure that our patients are first in every interaction.
Thank you, Renee. That was a great response.
Thank you.
Oh, we have another question. For the panelists that were previous interns, could you provide one of the hardest challenges after reflecting your experience of the internship process?
Sure, I'll touch on that. Believe it or not, it may not be hard to some, but one of my hardest challenges was networking. It wasn't the easiest thing for me, but I had to become vulnerable. I had to break down those barriers, and I had to be open. And I reach out to whatever resource that I had. Jenny, who was on here, she's one. She helped me out a whole lot, try to figure out what path I wanted to go in, who I should talk to, who I should meet with. And Angela helped as well. If I would have never reached out and asked for that help, I would never be here in the permanent position that I have today.
Yeah, I can actually expand on that as well. I think for me, it was something different. I think the main thing was I was trying to exceed everyone's expectation, that they understood who I was and what I was there to accomplish. The second day at Baptist, something that was a bit intimidating to me was that the COO had already knew my name. And in that, I kind of took a second to understand that there's going to be a lot expected out of me in these 8 weeks. And being that I had no healthcare experience prior to it, I didn't know how I was going to meet those expectations, but I kind of had to just, relax for a minute and remember why I chose healthcare in the first place. And that was to serve patients. Here at Ochsner, we put our patients first. And in that, it was easier for me to kind of settle in and, really work on my projects and complete them efficiently, because I kind of, had motivation now to actually complete them. I wasn't so worried about exceeding everyone's expectations, and, in focusing on my projects and, improving lifestyle and, living outcomes for our patients, I was able to end up exceeding everyone's expectations. So it kind of came full circle for me.
Renee, I see you have your hand waved.
Daquan, so I've never been an intern at this organization, but I did come into a fellowship program without healthcare experience. And so I think the hardest challenge, no matter how you come into this organization, because of its breadth and scope and overall scale, is asking questions. I think sometimes, to be just completely vulnerable, I had challenges our first 2 or 3 months in my fellowship program around asking questions, because you feel like you're on an interview, you want to make a good impression. But what I want to say is that the leaders that you interact with in this internship program, and across the organization, internship program or not, is that each individual, each team member here at Ochsner wants to help. And so as long as you approach your days with wanting to learn, wanting to be better, wanting to better service to either a patient or to the mentor that you're working with, that's really what's going to drive the overall experience of the internship. So I'm sure it's a challenge to ask questions, but don't be afraid. And and look, I'm a hypocrite at it, because first 2 months or 3 months, I struggled with that as well. So that's probably a challenge, but I also challenge you to be okay, be uncomfortable. And that's really how you grow here. And Ochsner's here to help you with your growth.
Thank you, everyone. That was great feedback. Another question for the previous interns. What would you say was your favorite part about working with Ochsner?
I can take that one on. I would say the culture. For me, I think I flourish in a work environment that is friendly, where we're performing as a team and everyone is kind of able to assist the next person. I feel like in a work environment where everyone is kind of selfish and, not looking to help the next person, I'm not able to flourish. And I think being that Ochsner is so friendly, that's why I was able to accomplish so much as an intern. It was very welcoming for me.
I can piggyback on that. That is correct. Just having a numerous amount of cohorts and that camaraderie with everyone. As I stated before, from the very first day, I was welcome. I wasn't shunned. I was welcome with my team, and that made me flourish, and it made me strive. Being a part of a well-knit team when everyone wants to help you and they want to see you succeed. And you come across people who've been here for 30, 40 years. I mean, for someone to work for an organization that long says a lot.
Thank you both for your responses. Is there any other questions in the audience at this time? Okay, if we don't have any other questions, Faye, can you repeat again about how they can apply to the internship program, dates and things of that nature?
Yeah, so the job will be posted in January and run through March 11th. And the program will run May 2022 through July, 8 to 9 weeks. Students will have time to take vacation during that as well too. So we've put that in there. But we hope that everybody will check out our career page and apply.
Thank you so much, Faye. And thank you to all of my panelists today for joining. Thank you to everyone in the audience. I hope everyone has a great Thursday. And thank you again for joining to learn about Ochsner.
Renee, did you have a question real quick before we end?
Oh, ma'am, I was just so excited. I was saying goodbye.
Thank you all
I know
so
I didn't
much.
get a chance to chime in because Renee did a great job. I just wanted to say thank you. You guys did a great job representing Ochsner, and I'm glad to see the engagement from the panelists.